Good afternoon, everybody. My name is Dr. Suleiman Bello. I am now the Chief Medical Director of Federal Teaching Hospital Katsina. I called you to brief you on the development that has happened to our dear hospital, the approval that we are able to obtain yesterday. So it's on the conversion of what used to be known as Federal Medical Center Katsina, now a Federal Teaching Hospital Katsina. So, gentlemen of the press, it is with all praises to Allah subhanahu wa ta'ala for sparing our lives to witness this day that I welcome you to this gathering. It is with great pleasure that I welcome you to this press conference on the conversion of Federal Medical Center Katsina to a Federal Teaching Hospital. As most of you are aware, efforts have been ongoing for many years now to convert the Federal Medical Center Katsina into a Federal Teaching Hospital for the clinical training of medical students of the Omar Musa Adwa University here in Katsina. The conversion is equal to an earlier approval that we've been able to obtain by Mr. President that sealed a memorandum of understanding between the federal government of Nigeria and the Katsina state government on the use of Federal Teaching Hospital Katsina as a clinical training site for training of medical students of Omar Musa Adwa University here in Katsina. The MOU was signed on 8 December 2020 by His Excellency, the Executive Governor of Katsina State, Right Honorable Aminu Bello Masari, on behalf of the Katsina State Government, and the Honorable Minister of Health, Dr. Osagi Enahiri Ehaniri, on behalf of the Federal Government of Nigeria. That occasion was witnessed by the management of both the Omar Musa Adwa University and the then Federal Medical Center Katsina, as well as the Katsina State Elders Forum. The realization of this great achievement will not have been possible without the contribution of various stakeholders, including His Excellency, the Governor of Katsina State, the Right Honorable Aminu Bello Masari, with the Katsina State Government, the Chief of Staff to the President, President Ibrahim Gambari, the Board of Management of the Federal Teaching Hospital Katsina, under the able chairmanship of the Chairperson, Hajia Hannatu Akelu, the Katsina State Elders Forum, under the chairmanship of Alhaji Ahmadu Kurfi, the Maradan Katsina, the Federal Ministry of Health, under the able leadership of the Honorable Minister of Health, Dr. Osagi Haniri, the Emir of Katsina, His Royal Highness, Alhaji Abdul Mumin Kabir Osman, CFR, and the Emir of Daura, His Royal Highness, Alhaji Farouk Umar Farouk, and of course His Excellency the President of the Federal Republic of Nigeria, President Muhammadu Buhari. On behalf of the board, the management and entire staff of Federal Teaching Hospital Katsina, I thank you very much for the opportunity given to us to witness this day. And indeed, this is indeed a day to remember for Katsina State. Katsina has long been known as the cradle of education, and it's actually surprising that we are among the last in the northern states to establish a medical school. But finally, with this conversion now into a Federal Teaching Hospital, there is no other limitation now to getting full accreditation by the Omar Musa Adwa University. As most of you are aware, they've already been given approval to admit their first set of medical students. And now all accreditations, all the requirements for getting accreditation to complete their medical training is now complete. And so they'll be able to finish their training within 6 years of admission and obtain their MBBS degree. So thank you very much for coming, and may God bless you.
What else should the patients visiting this facility be expecting from the development?
Well, as a Federal Teaching Hospital, the status is higher than that of the Federal Medical Center. So, number one, your budgetary allocation will increase. And with that, with more resources available, we'll be able to do better and put additional structures that we will be able to expand the services that we're providing. Secondly, it will be easier now for the hospitals, not only the Katsina Federal Teaching Hospital, but even other hospitals around that, because there will be more graduates available that will graduate here, that are familiar with this environment, and so will rather stay here to practice their profession in Katsina. And that will, of course, entail better service delivery for the patients in Katsina, such that many of those that travel from other far and distant places to come to Katsina do not necessarily have to travel, because they will have the healthcare personnel to be able to cater for their healthcare needs within their own local facilities and vicinities.
What about the financial burden?
The financial burden on
the patients?
On the patients, you don't expect. We've always been a federal tertiary hospital, and federal tertiary hospitals, we've been operating at a level that is consistent with that of teaching hospitals. Indeed, over the past few years, teaching hospitals have been the ones that have been referring patients to us to care for them, because we have some facilities that are not available within teaching hospitals. And so there's not going to be any additional burden on patients. The fact that the hospital will not change its policy of being patient-friendly because it is now a federal teaching hospital. It will still remain a federal tertiary hospital, and so we'll continue to render services for the people of Katsina. If there's any review in charges, it is not because we are now a federal teaching hospital. It is because of the realities on ground. Everybody is aware that not only in Nigeria now, globally, there's a global inflation going on now. Not only in Nigeria, the United States, Europe, everybody is facing inflation occasioned by the COVID pandemic, and then of course the ongoing war in Russia and Ukraine has actually brought a lot of mess, to the extent that a lot of European countries are now looking at potential financial collapse if nothing happens.
Yes, my name is Suleiman, the State Editor of the Nigerian. What's some homes looking for that under your tenureship that this place has been upgraded or converted to teaching hospital. Now with the present facilities on ground, I know since the stature of the institution has been changed, what work will you make to ensure that enough facility and other things they are provided to ensure that quality students they are producing? We don't want a situation where though the thing has been converted but nothing done.
Well, remember that the training of medical students is the responsibility. The students are going to be students of the Omar Musa Adwa University. The teaching hospital is the practical training site for them. They are not going to come to the teaching hospital until after 3 years of their preclinical training, which is going to take place at the preclinical campus at the Omar Musa Adwa University. Now, when they finish their 3 years of preclinical training, then they will move over to the clinical site, and that is when our own interaction with the students is going to start. As most of you have seen, you will see that behind this administrative block, there is ongoing construction by the Katsina State government, providing facilities already: student hostel, lecture halls, laboratories, the social and amenities and facilities meant for students that are expectedly going to be arriving here within the next 3 years. Now, on our own part for the hospital has been expanding its services. As I speak to you today, this hospital has virtually every subspecialty of medicine is now being practiced in this hospital. I think the only unit that we're yet to establish is cardiothoracic surgical unit. And we do have about 3 doctors that are currently training. They are currently in Aminu Kano. When they are done with Aminu Kano, they are going to move to Marrakesh in Morocco, and then from there to India to do the additional practical training. And before the medical students come, we'll have established the cardiothoracic surgical unit here to be able to do cardiothoracic surgeries. Apart from that, the hospital has been making attempts to expand its services. I'll give you an example. The fibro scanning facilities that we have, which is for early detection of liver fibrosis. is only available in Katsina, in the whole of Nigeria. No other hospital in Nigeria has a fibro scanning machine today. Only Federal Medical Center has a fibro scanning machine. The optical coherence tomography machine that the hospital has, which has an inbuilt angiography machine, is only available today in Katsina. No other hospital in Nigeria has that machine, minus the Kunle Hassan Foundation, which has just acquired one in Lagos. And as I'm speaking to you now, 2 of our ophthalmologists are in Lagos undergoing training on laser surgeries for ophthalmology. They will be there for the next 5-6 months. And in 6 months time, we're expecting they're going to be back. And when they're going to be back, the surgeries they will be performing is not done anywhere in Nigeria, minus where they did their training in Lagos. And that means this place will be the referral site for all such facilities. Because even Makka Specialist Hospital that does these surgeries, what they do is they couple the patients, put the patients together, and import the surgeon to come from Pakistan to do the surgery. But we are currently training ophthalmologists that will come back and be doing the surgeries here. Most of you are aware, we are constructing now a radiotherapy and oncology unit for treatment of cancer patients. And we've gotten the funds and are awaiting the FEC approval. Hopefully, within the next 1 or 2 weeks, we should get the FEC approval that will enable us, because the funds for procurement of the cancer treatment facilities are already in our bank accounts. All we are waiting for is FEC approval. As I speak to you, we have radiographers, we have medical physicists, we are just about to send the oncology nurses and the radio oncologists. All they're in Lagos, they're training at the NSIA Loose Center, so that they'll be able to come back home and man the radiotherapy oncology center. Now, our own radiotherapy oncology center, currently in the whole northern Nigeria, only National Hospital has a radiotherapy oncology center. But Maiduguri is currently establishing one, Sokoto is establishing one, and Zaria is going to establish one. The 4th one is going to be in Katsina, and then there's going to be one in Jos. But in addition to that, we're also going to establish a nuclear medicine center, a SPEC-CT. If we put the SPEC-CT, that will be only the 2nd in Nigeria, because currently only Evercare in Lagos has a SPEC-CT. And so the next one is going to be in Lagos, and then of course the Lagos University Teaching Hospital is going to establish one. So I think the whole essence of it is that this hospital has been making attempts to expand the scope of services available, and to ensure and make sure that patients, when they decide they don't want to access care in Katsina, they are doing it of their own choice, not because the facilities are not available or the specialists that will care for them are not available in Katsina. For now, we are getting referrals from Zaria, from Kano, people are coming from Abuja, people come from Delta, from Lagos to access treatment in Katsina. Because even though people here complain that our services are expensive, people that travel know that our services are very cheap. If you want to know our services are cheap, just go 170 kilometers down to Kano and see what the cost of healthcare services are, and compare them to what is available in Katsina. And then compare now the quality of service that we deliver compared to what is available in those places. And that's when you realize that in this hospital, we try to do it with a human face. We realize that yet the people surrounding the hospital, the purchasing power, is not as good as those in Abuja and Kano. And so we're very moderate in the way we charge our patients. But then, of course, healthcare is not cheap, and quality service delivery is not cheap. And somebody has to pay for the services that are delivered, because there's no freebie. Thank you very much.